We're talking about what happens after you have recovered from COVID-19. What we have noticed from our patients is that they, quote, recover from COVID-19, but they're complaining of new symptoms. The most common one is they feel like they're in a fog. Their brain doesn't work as good as it was. They're tired. They have no energy. They get tired just doing simple things like housework. They may be more anxious about everything. Even depression has been reported. And then they don't feel like themselves. Coronavirus is not a new thing. It's been actually identified in the 1960s. We've had 3 epidemics or pandemics, depending on the numbers. The first one was in 2003, called SARS, or Severe Acute Respiratory Syndrome. The second one was in 2013, 10 years later, MERS, because it happened in the Middle East Respiratory Syndrome. And now in 2019, we have COVID-19, or the novel COVID-19, because it has mutated a little bit, and that's why it's causing so much trouble. I'd like to kind of give you a overview of what I'd like to talk today. I'd like to talk to you a little bit about the pathophysiology, what happens to our body as it's attacked by the COVID-19, in contrast to maybe some of the other viruses like the common flu. Then I'd like to give you a little bit of an idea of our treatment protocols. And then lastly, hopefully I leave you with some nuggets that can help you with your immune system so that you can actually enjoy life a little bit more. So what's amazing about this coronavirus is that it can attack almost every single organ in our body. Obviously, respiratory is what gets us the most. And because we are so dependent on oxygen, if our lungs doesn't work, then every other organ goes into shock. And that's what basically it is. The body goes into shock, or a cytokine storm. That's another term is being used. It affects our liver, which is obviously needed for life, our kidneys, our brain. Our immune system goes haywire. And a lot of patients also get affected by the muscles. And then they have these chronic muscle pains that can last for a long time. And we have actually there's a medical term for that now. But when we look at viruses, all viruses can cause some of these symptoms. I'm going to give you a couple examples. The Epstein-Barr virus is commonly known as mono. It's been around for a long time, and most of us get mono, if we get mono, and usually it lasts a few weeks or two, and then we're back to normal. But there's a percentage of patients that will have severe problems, including where their spleen ruptures. They have low blood counts. They may even have myocarditis, and in some patients, they go into congestive heart failure. The nervous system can be affected, the immune system as well. And there's this thing called schizophrenia post-mono. And it took a long time before we actually used the term chronic active mono, or Epstein-Barr virus. Now we have a new term, post-COVID-19 long haulers. We know that being infected with the Epstein-Barr virus gives you a higher chance or a higher incidence of getting multiple sclerosis, rheumatoid arthritis, diabetes, thyroid disease, as well as celiac disease. We don't know what we're going to see after COVID, but there's already signs that we're going to be looking at these links with other diseases as time goes on. If we look at H1N1 influenza pandemic in 2009, 10 years later, Patients are still suffering from chronic fatigue, chronic alterations in the nervous system, with irregular heartbeats, and overall decreased lung capacity, which is, again, very vital for our day-to-day living. COVID-19 is unique in some respect in that this particular protein that the virus has, called the spike protein, inserts itself in our body and affects what we call the angiotensin converting enzyme 2. Just think of it as a protein, a vital protein in our body. It actually requires zinc to function properly. And that's why you hear in the news and everywhere else that you should take zinc. Well, zinc is very important for your immune system and for your body in general, which is something that I encourage everybody to be aware. For good health, you need good nutrition, you need good minerals, and so forth. This particular protein, ACE2, it's in every single organ of our body, and these are just some examples. And depending how hard the virus hits the organ is what kind of long haul effects you're going to have. Obviously, the lungs, we all hear about it. It also, this enzyme or this protein, it's in your vessels, it's in your brain, it's in your testicular Leydig cells, is in your kidneys, is in your pancreas, is in your adrenal system, is in your brain and the hypothalamus, is in the thyroid, etc., etc. So basically, this particular protein or enzyme is crucial. And so that's why this particular virus is causing so much problem, because it can actually insert itself into that sequence of that and basically scramble the way we function. And the body doesn't know what to do and goes into attack and goes out for the kill. And that's what we call the cytokine storm. It's the same basically pathology that we see with septic shock, or when somebody is in a bad car accident and almost bleeds to death. The body goes through these different reactions to try to survive. And it's in the thyroid, and most of us know that the thyroid is important, the way we feel, how much energy we have, how we feel in general, the hormones that makes us a male or female are important the way we feel. And if all these organs get affected, we actually not going to feel ourselves. And that's what the patients are saying. I don't feel myself. I don't feel like I have the same energy as before. I can't think as fast as I used to. I'm in a fog. I'm somebody else. And that can be obviously very distressing and cause a lot of anxiety. After you recover from this coronavirus, you can see the particles of the virus or the byproducts, the inactive proteins, for weeks and months and maybe even longer. That means that the body has not been able to get rid of that foreign protein or substance for a very long time. And obviously, if you have more severe infection, there's going to be a bigger viral load. The body then has to repair itself because the cells or the membranes that each cell has been damaged, and it can take some time for that to repair. Sometimes the body gets overwhelmed, and that's why we see some patients with viral infections having long-term problems. If the body cannot help itself, we may have to do some therapies to try to help the body heal itself. Multiple systems have to get back to their normal function, and they have to work in sync. It's just like a computer. If the parts are not communicating, it doesn't function like it's supposed to. A car cannot function properly if half of its systems are not working. If we looked in an example of this, and I kind of wrote an article, a little article that was written some time ago that after SARS, that happened in 2003, 40% of those patients had some kind of hypercortisol. And cortisol is extremely important for our day-to-day living. It's how we deal with stress, for example, and obviously multiple other functions. And 80% of those patients have had central adrenal insufficiency, meaning that they needed some kind of medical or drug or something for the rest of their life. So what's our goal when we see somebody that has survived the coronavirus and is dealing with some of these symptoms? Every patient is going to be a little bit different, but the principles are very much the same for everybody and basically for any kind of infection, especially viral. We want a detox. And I'm not talking about detoxing from alcohol or drugs or so forth. Every cell has byproducts that needs to be excreted. We need to get rid of all those proteins that the virus has left in our body. Because they are residual proteins, we need to reduce the inflammation. So even if, quotes, you have recovered from the COVID-19, there are certain markers that we can obtain from your blood that will show that our body is still fighting. They're still inflamed. And the immune system is overworking. And for the body to be able to repair itself, we need to provide the building blocks. I call them the building blocks, but it may be good nutrition, it may be particular supplements, and maybe it's for a month or so, it may be for a year. It all depends on how your body deals with this attack, basically. So when you come to see us, number one, we're going to do an evaluation after this infection, and it will depend. We're going to be looking at, for example, do you have other comorbid diseases? Are you a diabetic? You have coronary disease? Do you have problems with your kidneys, your liver, your thyroid, etc.? And we're going to get some tests to look to see how much stress your body is in, because that would determine how many things or how many therapies we need to suggest. One of the important ones in our clinic is what we call hyperbaric oxygen therapy. And we do have a chamber that is big enough for 6 people to be in there. So don't think it's something little small. And there are some particular protocols that have been slowly being developed by multiple clinics across the country. And one of the very unique things about hyperbaric oxygen therapy is that, number one, is the only FDA-approved non-hormonal therapy that can regenerate tissue and repair our bodies. But more important, as you see, number 8, we want to stimulate our own stem cells to repair our body. One of the new therapies being looked at is called exosome therapy. Exosome has been around now for just a short period of time, where it's, let's put it, commercially available, is being looked very closely for this post-COVID long haulers, and we'll see where that data how much and where that data is going to end up. We do want to improve your immune system. We're not talking about immunosuppression or anything like that. We're talking about the immune system. We all hear about taking extra vitamin C during this pandemic. Well, what does vitamin C do? Vitamin C improves your immune system. Vitamin D, for example, actually vitamin D is a hormone. It's important in the immune system. DHEA, for example, it's also important in the immune system. Pregnenolone is also one of those supplements that we can take to improve our immune system. If the nervous system has been affected significantly, we may consider adding NAD, which is a chemical, so to speak, that is required for our cells to function properly. The adrenal system may need to be supported. And there are different drugs or supplements, depending on the severity, that we can use. If the thyroid organ has been hit, may need some support, and hopefully these organs come back and you don't need to take it forever. But the thyroid is being hit pretty hard sometimes with this coronavirus. And if sometimes we need to supplement some hormones, it may be both male, female, or other hormones that we may need to be supported for a period of time. And obviously, I always like to talk to patients about their diet. Not that I'm a dietitian per se, but I like to suggest things that are good for recovery, so that the body has the building blocks to repair itself.
I didn't realize so many people are living with long haulers. So how many people are expected to experience this who have tested positive and survived?
Yeah, that's what is intriguing all of us, because most viral infections, the incidence of long-term, let me put it, the incidence of long-term problems with most viral infections, it's usually 1% or less. And in some, like the mono, may be a little higher than 1%, but it's usually a very low percentage. The initial data coming out of several places is that the almost 30% may be actually getting some degree of this long hauler post-COVID syndrome. And that's what concerns us in the medical field, is that, we survive the coronavirus, and then such a high percentage of people are going to have some degree of this post-COVID coronavirus.
And I did not know, it was interesting what you were talking about earlier. How is the virus able to affect so many organs in the body? If you can kind of go into that a little bit.
I guess, like, I don't know if we have that slide, but the unique, and maybe that's why we call it the novel coronavirus, is because it actually is attacking our organs in a very different way than other viruses, because it attacks that particular critical enzyme or protein called the ACE2. And because that particular protein or enzyme is everywhere in our body doing some kind of function, it hits us very hard.
And how long, you outlined someone comes here, the treatments that you offer, how long does a treatment typically take? I know everyone's situation is a little different. So
most of the patients that we have been fortunate to help usually have had symptoms not much longer than less than a month, let's put it that way. And those patients may take a few days of treatment, and they start to feel better in about a week or two. So it varies a little bit, but we're not talking about months of treatment, but usually the protocols are 1 or 2 weeks, and if the symptoms are mild, maybe even less.
One of our viewers wants to know, can they just call and make an appointment?
Sure. Obviously, that's the easiest way to get to us. I do encourage that if you make a call, and be very specific that you want to talk about and be seen for this particular problems, because obviously we see a lot of other things. And if you do mention that you want to be treated for post-COVID long haulers, we're going to make every effort to have you come in right away, because time to some degree is important.
Let's talk a little bit, Dr. Schmidt, about when can a person receive treatment? Like, what is the window after you've tested positive?
Yes. So the infectious period after you get the coronavirus is probably somewhere in 7 days or so. We keep people a little bit longer quarantined for safety more than anything. So most patients, after they're infectious, we allow them to come to our clinic. And so from the last test, positive test, it would be about 7 days to 10 days.
And what are some of you mentioned the detox and how it's different from alcohol and drug detoxification. What can you highlight what some things you would ask people to do when they're in the midst of this treatment as far as their health is concerned?
Well, maybe I'm not using the term detox or confusing people a little bit with the detox. When I think of detox in this type of medical problems, think of it that each cell to function produces some byproducts. Just like a car, it produces fumes. Let's leave it at that. So each cell itself has to produce a certain amount of waste. That waste in general gets filtered through our liver and our kidneys. Well, if the body's not functioning properly, those cells may not be able to excrete that. That's what I mean to detox. And so there are simple things, increasing your water, for example, intake can help your body detox. Having a good immune system helps you detox. Sometimes you do have to use a little bit more aggressive therapy. May include some IV hydration or some IV infusions of vitamin C, for example, or hyperbaric oxygen therapy is a powerful detox.
And if you want to talk about the steps of when someone comes in as far as the CRP test and what you're looking for, I think you kind of went over that earlier, but just so that someone can know what to expect.
Yeah. So as we were confronted with this awful virus, obviously multiple places have gone multiple tests to see how bad the body was affected. And there is what we call a panel of labs that we can do that looks at the way the body is dealing with inflammation. We find out that those particular CRP and SET rate are very basic tests that in the post-COVID phase, it's a very easy tool to see how bad or how well your body has dealt with its stress. And so we don't go into very esoteric tests because you have recovered from the COVID. We just want to see how you progress. If the lab test shows that you have a lot of inflammation, then we might be a little bit more aggressive and propose maybe a little longer treatment.
Are there any other questions out there? Okay.
If you had the virus months ago, in this case 4 months ago, would the therapy still be beneficial?
If you are still having some of those post-COVID, well, let me repeat the question. Did we hear the question right the first time? Okay. So 4 months is not uncommon. And again, it depends, if you haven't recovered in 4 months, that means your body is struggling to repair itself. So 4 months is not uncommon these days. 5 months may be the same thing. It all depends on how much damage there has occurred. It may just take a little longer and it may take a little more aggressive. But what we are scared is that we don't want to see some of those symptoms that we see in other viruses where patients are suffering for months and years afterwards.
Got another question coming for you, Dr. Schmidt.
Okay.
Let's see. What treatment will improve the lungs?
So as far as the lungs is let's use the word tricky organ, in the sense that if there is what we call fibrosis, may be a little harder to treat than if you just have inflammation and the air sacs are not able to exchange the gas properly. Then we may have to do a little bit more aggressive. But there are some things that we have done with other patients that did not have COVID. They have some of the same problems, and we might be able to improve that as well.
I know you might have touched on this earlier, but I was just wondering, from the time a person starts a treatment, what is the typical time that they begin to feel relief or begin to feel like themselves?
All our patients that we have treated, they start to feel better in about 2 weeks. Sometimes sooner, but that's usually what I see.
Here's another question from our viewers. Do we have lab diagnostics that indicate the lasting effects of COVID on the immune system?
There are some, let's use the word generic labs that kind of tells us about the immune system and so forth. But at this point, we don't have an available test that can say all this happened because of COVID. I think that may be coming, but we don't have a test that can say all this was caused by COVID.
And you mentioned the sooner the better a person can come in and start treatment.
Correct.
Right?
So it just makes it, there's less damage. This thing is just like everything else. If the body can start to recover sooner, it can do it much better. As you can see, we're not using drugs. We are helping the body heal itself and get back to baseline.
So no one would leave with the prescription of anything that isn't vitamins or nutrients or something.
Well, I will say nobody. We may find things that need to be addressed as well, because again, the body works as a unit. So, we may find that you need something. Let's say your blood pressure it's awful, too high or too low. Well, we may have to treat that. The treatments that we are using are not unique to me. Multiple clinics across the country are looking at different treatments because every patient is different. It's hard to say that everybody's going to need the same thing. Okay.
We have
there are, last I saw, like 300 and some studies looking at just hyperbaric oxygen therapy, for example, in post-COVID. And I don't know how many for the other ones.
Just a question here, Dr. Schmidt, about what is your opinion on herbal immune support such as elderberry and echinacea and the like?
Every patient, number one, is different, but yes, I do believe that herbs can help in your immune system. If you think about it, all drugs started as natural products, something in nature. Most of them started that way, and then we make a chemical out of it or identify the chemicals. So yes.
So it sounds like a combination of all these things just helping the body do what it can do naturally.
Right.
Because
so I saw recently a patient that had COVID 5 months ago. She is functioning. She's kind of back to work, but is not, she's still fatigued and so forth. So her treatment may be very different than some of the patients I saw, within the month that basically are just surviving.
We still having any questions coming in? We're good? All right, Dr. Schmidt, I guess we are ready to close it out. We just want to thank everyone for joining us. You can find information there on the slide on our website or give us a call at 731-660-2056. Stay safe, everyone.
Thank you very much, and good health.